Hi, I'm State Representative Doyle Heffley, and welcome to this edition of Legislative Report. Today we are at St. Luke's Hospital, the Heighton campus, with Michelle Brantz, and we're talking a little bit about some of the newer technologies in the fight against breast cancer.
That's correct. Well, thanks for having me.
Yeah. So, Michelle, as just if you could maybe talk a little bit about some of the pre-screenings or what women should do as you know they look into making sure that they're going to stay healthy.
You know, with all the amazing technology we have, the first and foremost thing that a woman should do is, beginning at the age of 40, she should go for her annual screening mammogram. A woman coming in for a mammogram the first time, here at St. Luke's, we take an extensive family history. We want to find out what her risk factors are relative to her health, disease in her family, any history of breast cancer in her family. But a precursor to breast cancer is often dense breast tissue, because dense breast tissue and cancer look the same on a mammogram. Okay. And that's why all of these great technologies really help the radiologist to zero in and determine, is this a cancer or is this just dense breast tissue? But that annual mammogram is so important. And for many women who are getting their mammogram for the first time, they will be called back. And that is a normal thing.
I think you said about 60% of women that have their first mammogram do get the call back for a further follow-up.
And, you know, anytime any one of us gets that call back, it is nerve-wracking. But to go for your first mammogram and to hear that can just be, you know, really rock your world. But the reason for that is that radiologists are reading and interpreting imaging based on comparisons. And when a woman goes for her first mammogram, there's nothing else to compare it to. Okay. So if there's anything there that's slightly suspicious, that dense tissue that they just don't know what it is, they're going to bring her back, focus that area, and now they have imaging they can compare to. So it's very, very common.
And if there's younger women than 40 and they believe they're having an issue or they have a concern, they should definitely, you know, follow up right away and not wait. I mean, the prevention is the key, and early detection is the key.
It is, and we see it a lot. We see it a lot, and I think it's really important for women, you know, to be going for that gynecology exam every year, seeing their gynecologist, going to their primary care physician annually. These are all preventive measures that are so important to really keep healthy, and to, if there is something there, to give you your best chance at finding it early so it can be treated and eradicated.
And that's what we're looking at behind us, is the treatment and the eradication. So the key is, you know, to get those exams and stay on top of your own personal health. But then if there is any concerns, and the follow-up. So if we look behind you, there's quite a bit of equipment. Yeah. So if you want to just talk a little bit about, so if somebody comes in for a mammogram and maybe there is something detected, what is the equipment behind us? What is the importance of it? What does it do? And why is it cutting-edge technologies that we have right here in Carbon County that are going to be saving lives?
Yeah, thank you. So this is actually, we're in the ultrasound room. And so after a woman would have had her diagnostic mammogram, she would come in here for her diagnostic ultrasound. They're scanning exactly at the area that the radiologist has determined needs, you know, an additional view. And they're performing the ultrasound. The radiologist will then look at all the imaging. He or she will correlate the mammo to the ultrasound. This way they can see it under both modalities. In mammo, cancer is going to appear white on black. In ultrasound, it's going to appear black on white. So you get to see it in both different, you know, views. But what we're doing here, and what you have been so paramount in helping us secure, is this Savvy Scout.
It doesn't look like much, but when you talk about what it does and the technology that's in it, it's pretty amazing.
It is amazing. So historically, a woman who is diagnosed with breast cancer, we would perform her biopsy. She gets the pathology back. She's diagnosed with breast cancer. When at the day of her breast surgery, she would have to go to the hospital early, go into radiology, and radiology would perform what's called a needle localization. It's a thin wire that would be inserted into the breast to mark the area of suspicion for the breast surgeon. Okay.
And that's the technology that's most widely used, and that's the old technology.
That's the old technology. Yeah. That was the way we did it for decades, yeah. Right? And you can imagine that moment where you are so nervous already that you're going in for breast cancer surgery. And now to have this additional step, have this wire coming out of your breast, you're laying on the stretcher, you're being, taken from radiology to the OR, to the holding areas. This has the potential to migrate and move as the patient's being moved around, but it was the best we had until recently. And this little equipment is called Savvy Scout. And what we can do now with this is at the time of biopsy, when it's a high suspicion that the patient could have cancer, at the time of biopsy, the radiologist can insert what's called a reflector, and it's about the size of a grain of rice. And they can inject that right into the area that they've just biopsied, so they know exactly the spot they're looking at. And this detector, this wand, it's like a sonar, so it will then detect on the body in the breast exactly where that area is.
Okay.
A similar console is in the OR. And so now, and this woman can walk around with that reflector in her breast. FDA has approved it in perpetuity. It never has to come out. It's not going to set off alarms at the airport. You never even know it's there.
It's just something for the location of the area that was biopsied, so they don't have to go looking for it. They know exactly where it is.
Correct. And now when she goes into the OR, they have a similar console, and then they can also, the surgeon can go right to that spot, detect it, it sends the signal, and they know exactly where they're taking that breast tissue, getting rid of that cancer, doing a lumpectomy, and it's just so non-invasive. The woman can, it's not another appointment. It's not, it's all done, at point of care. So it's just been fantastic.
And then some of the other technology you have, when the surgery is being done, they would do the surgery, and then they would have to send the images out to be read, and then come back to the surgeon. So the patient would then be in surgery a lot longer while those images were read so the surgeon would make sure that they removed all of the what they biopsed or what they're biopsying. So you could talk a little bit about the time frame and how that has improved.
It's amazing. And so it's the technology is called a faxitron. And what it is it's going to be able to image in the OR that the specimen that the surgeon has taken out. They want to make sure there's clean margins all around that they've gotten all the cancer, right? And you're right. They used to have to take that specimen and go down to radiology and x-ray it. Now that's more time the woman's under anesthesia, right? And now we can do it right in the OR. So it's happening in real time. We're getting the patient out of anesthesia faster. You're getting through the surgery faster. And you have your answer right there. There's no back and forth.
It's definitely going to make for better outcomes. And it is critical that we keep making investments like this in the newer technologies, and that we have a partner in St. Luke's Health Network that's going to bring these technologies to a rural county like Carbon County. In the past, if you wanted to have a procedure like this done, you would be traveling to the Lehigh Valley, if not Philadelphia, or even farther. But right now, we have these cutting-edge technologies right here, and it's really key to women's health.
It is. We love being here in Lehighton at the campus. Every week, our fellowship-trained breast imagers travel here to do the diagnostic breast imaging, to perform the biopsies. So exactly that. The woman does not have to, travel down to the Lehigh Valley or beyond.
And that's the key. What we really want to do is make sure that everybody's healthy. And breast cancer can also affect the male population as well. So what would if they're a female or a male doing a self-exam, what would kind of be a flag that, hey, maybe we should follow up, so like if God forbid they need this technology, it's here for them, but that they catch it early on?
Yeah, it's a great question. So when a woman does a clinical breast exam, she really should understand kind of what her unique architecture and her breast feels like. And as we age and hormones change in our bodies, that's going to change too. But at least, being educated in your own body, right? And the same for a man. For men who have a history of breast cancer in their family, they are going to be at a higher risk for breast cancer. But there's so many other factors that go into it, nutrition, exercise, and all the things that for every other disease state, right, that help us to be healthier. But really, anytime a man or a woman would find a lump in the breast, any kind of discharge coming from their nipple, anything like that can be a symptom that maybe there's something else going on. Might not be. It could be. Everything could be okay. But that is absolutely should be checked out by their either primary care or their OBGYN doctor. Yeah,
so certainly, that's the thing, is early detection so that we can utilize all the technologies that we have for better outcomes.
Right.
So,
yeah.
Well, thank you so much. This has been really enlightening, and thank you for all that you do, you and all the folks here at St. Luke's, for bringing these new technologies into rural communities like Carbon County and the entire region. People from Hazleton and Luzerne and Schuylkill County, Monroe County can all utilize this facility, and it's really going to improve outcomes.
Well, thank you. And thank you for all that you do. We appreciate it.